Blood flowing down the nose of a child is a scary as well as a panicky situation for the parents. Hi, I'm Dr. Ram Babu. I'm a Senior Consultant ENT Surgeon, Apollo Hospital, Jubilee Hills. Today I want to apprise you of this common condition that we come across, bleeding from the nose. We come across a lot of children having blood coming out of the nose, and it's a very scary situation for the parents, and they panic on seeing the blood coming out of the nose. I want to just give some background about this problem. The blood is coming from the nose whenever the blood vessels rupture, they come out. The blood comes out of the nose as few drops to sometimes continuous flow. This is because the blood vessels in the nose are very, very delicate and very superficially placed in the skin lining, and due to some reasons they break down and the blood starts flowing out. We look into some common problems where the blood comes from the nose. Very commonly, the children have infections in the nose, and they have cold, allergies, sometimes sinus infection, and sometimes adenoid infections. These all the infections increase the blood flow in these blood vessels, and due to a minor trauma, the blood starts flowing out. The minor trauma could be just picking up the nose or rubbing against a pillow also, this blood starts flowing. Other than these infections, there can be some direct injuries to the nose, like a fall or hitting into an object. Sometimes sharp object inside the nose. Also, it can be reason for the blood coming out of the nose. Overall, this bleeding from the nose is not a panicky situation because it has a self-controlling mechanism, and usually 8 to 9 times out of the 10 the bleeding will stop on its own. The first aid measures that the parents have to learn about this particular problem if it is repeating is just pinch the nose with both the hands at the time of the bleeding, and keep that pressure for about 3 to 4 minutes. Usually all the bleeding conditions, they stop. If it is getting recurrent or repeated, probably that is the time that you have to visit an ENT doctor to find out what could be the reason, and those reasons can be easily cured. So we come across these children having the allergies and sinus infections can get better with the proper treatment. And sometimes we give some ointments and some gels where it will reduce the dryness of the skin, and the bleeding also can stop. These sometimes, very rarely, that continuous bleed or heavy bleeds need to be really addressed to. Sometimes we close the blood vessels and the outpatient procedures by a chemical, or sometimes we have to take the child into theater and close the blood vessels by some cauterization methods. The backdrop of the infections like adenoids have to be addressed sometimes, and the repeated bleeding has to be addressed by controlling the allergies. So overall, the bleeding from the nose should not be taken as a very serious problem, and most of the problems can be controlled and reduced over the period of time. Another thing is that the parents also should learn about this problem is over a period of time, as the child is growing up in his age, like when he reaches around 8 to 10 years or 12 years, all these blood vessels which are very much superficially placed and commonly they get injured, they go into the deeper layers of the skin, and the bleeding automatically stops. Some children have this problem due to familial tendency, like their parents or some of the family members having. These children also, we have noticed that it reduces after some age, usually around 10 to 12 years. So overall, this particular problem, though looks very scary, a panicky situation arises on seeing the blood, parents should be composed and attend to it with the first aid measures. Thank you.